Good night. I'm going to talk about the heart and circulation number 2. Physical examination. Medical examination is normally carried out in 4 stages: inspection, palpation, percussion, and auscultation. Note, the verb is palpate. The noun is palpation. Noun palpitation. Examining the heart and circulation. Here is an extract from a textbook description of how to examine the cardiovascular system. Look at the lips, tongue, and nails for the blue discoloration of cyanosis. Cyanosis may be central or peripheral Inspect the hands for clubbing. Feel the radial pulse at the wrist and note the rate and rhythm. The pulse may be irregular in force as well as time. Check that the other peripheral pulses are present. Measures the blood pressure and assess the jugular venous pressure. Palpate the chest for the apex beat. The normal position is the fifth left intercostal space. 1 centimeter medial to the mid-clavicular line. Feel for any thrills. Heart size may be measured by percussion. Listen for murmurs and other abnormal sounds. For example, friction rubs. Beginning at the mitral area, murmurs may be soft or loud, and harsh murmurs is loud and raw. Note the time of any murmur in relation to the cardiac cycle. The most common murmurs are mid-systolic, pan-systolic, early diastolic, mid-diastolic, and late diastolic. Continuing by listening at the tricuspid, aortic, and pulmonary areas. Areas of auscultation. The letters indicate the approximated position of the heart valves. Pulmonary valve, aortic valve, mitral valve, and tricuspid valve. The circles indicate the position of auscultation for cardiac murmurs, indicating valvular heart disease. The ribs are numbers. Thank you. Now I'm going to read the exercise. Complete the table with words from A opposite. Verb: auscultate, examining, inspect, palpate, and percuss. Noun: auscultation, examination, inspection, palpation, and percussion. Put the steps for examine the heart and circulation in order. Number 1, feel the radial pulse. Number 2, locate the apex beat. Number 3, measures the heart size. Number 4, are there any murmurs? Number 5, look for clubbing. And number 6, note any drills. A doctor presenting the case of 43-year-old woman at a meeting in the cardiology department. Complete the text of her presentation. On examination, she was pyrexial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and pyrexia. Her blood pressure was 130 to 80, and her GVP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulse were all present, and there was no delay or central cyanosis. Her apex beat was displaced to the anterior axillary line, but still in the fifth intercostal line. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pansystolic and mid-systolic murmurs. Her heart best at the apex. When she was examined some hours later, there was a harsh pericardial friction rub all over the precordium. Or diagnosis at the time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Thank you. Ahora voy a leer los ejercicios en español. Completa las tablas con las palabras del punto opósito. El verbo: auscultar, examinar, inspeccionar y palpar. El pronombre o sustantivo: auscultación, examinación, inspección y palpación. También está percutir y percusión. Pon los pasos para examinar el corazón y la circulación en orden. El primero es localizar el latido. El segundo, medir el tamaño del corazón. Tercero, ver si hay Número 1. Localizar el latido del corazón. Número 2. Tomar el pulso radial. Número 3. Medir el tamaño del corazón. Número 4. Ver si hay algún soplo. Número 5. Buscar el hipocatrismo digital y observar si hay algo diferente. Y completar los espacios en blancos en el caso de la mujer de 43 años. La primera es pirexia, la segunda es pulsos, la tercera es sin retraso, cuarta central, quinto es el latido, sexto es la línea, séptimo es soplos y la última es frote. Es cuánto.